I'm still eating healthy, so my reward are chicken nuggets.
And that's good. It keeps you focused throughout the week, and you're like, hey, I can't wait for those chicken nuggets on the weekend.
Right.
Yeah. Oh. So I guess just let everybody know about your future endeavors with respect to social media.
Well, with social media, okay, so my plan is, I got a blog, and I made this blog about almost a year ago. We were just saying that. I'd like to, I have a few collabs that I do on there with, a nutritionist. I've had an athletic therapist on there as well. And so I find it's very helpful for people because a lot of my patients do read it. And so sometimes I will get people, right now I'm doing a pregnancy series with one of my good friends. Her name's Danielle. And so I was so shocked to see, the response from that. She talks about the nutrition side of pregnancy, and I talk about, low back pain, different parts of the pregnancy. So it was very interesting to see, there's information that people want to know, but they haven't told anyone. So I always ask for questions on my story. So every once in a while, I'll always put on stories what would you like to learn more about? And so I've always gotten really great responses, things I would never have thought of. And so I feel like that's super interesting for me because I'm I would have never, okay, I didn't really think that was something. If I can't address it, I'll find someone who can, and I'll put it on there. But yeah, and I want to, like we were talking about, making videos. But yeah, and I have a few workshops that I'm doing, a few talks later in the future, not anytime soon, but yeah. But yeah, I just want to promote chiropractic and just make it just something that people aren't so scared of.
And yeah, I think, and what I was just saying earlier, just about the oversaturation, some people may ruin the name for everyone, but what I'm getting from meeting you care about your patients. You take the time to really figure out what's wrong. Like you were saying, it takes an hour of your first appointment
visit. Yeah. A lot of offices are like that. So that's why I'm surprised when someone comes in and they've never had that experience and they're like, why is it an hour long? And I'm like, because we're going to talk about you. That's the point.
Yeah, I'm not just trying to make money. I'm trying to help you live better. So.
And especially, sometimes you need to refer them out. If I know I can't see this person, or if you know what, they need a bone scan, off you go to go get a bone scan. I'm not going to do anything until you get one. And it's sometimes I think, like I said, there's not enough information for everybody. And so sometimes it will come in just for a consult. And I've had times where I've had to refer somebody to a hospital because I'm like, and I'm like, right now, a walk-in clinic is not the place to go. You really need to go to the hospital. The closest one to us is Concordia. So we have sent a few people down to Concordia, and they get checked out, they're cleared, they're good to go, and then we can move on from there. But it's always just about the person. That's how I feel when I go to any of my healthcare providers, and that's why I say it's always good to find out more about that person. If you won't jive with everybody, right? And so you want to find someone that you can trust, that will take care of you. And that's kind of how I am, even with my parents. My parents are always going to doctors right now, and so on my days off, that's what I do. I spend my day off traveling around and taking them to their appointments. And even there, a lot of their doctors know that I'm a doctor, so they will change some of the wording so that way I understand it better. And so also with my parents, we do have, they don't speak English as well. They can do it. They can do it. They can understand. But
it's hard, though. If you don't learn a language when you're young, it's so hard to learn when you're older.
Right. And, and it's I can speak Hindi and Punjabi. So sometimes I'll have patients who come in who don't speak any English. And they only speak Hindi, Punjabi. It's a little bit more challenging for me to do a history exam in that language because I'm not used to those words. So it's funny. It's a funny joke that I will call my mom to ask her what this word means in Punjabi, and she's like, oh, it means nerves. I'm like, okay.
Oh, that's cool though.
Yeah. And same, we have another doctor there who's also East Indian, so same thing with him too. And also with different cultures, even if you speak that language, they might have different dialects. I know with us, we have different dialects as well. And so I find pictures are so great with helping, and you're like, can you just point to what you're trying to say?
There was something, I think, coming up in BC. You can just write out a care plan, and then it'll translate it for you.
Oh, okay,
in that specific language. So
sometimes people come with translators. I feel like I'm my parents' translator. That's kind of how it goes.
That's cool, though. I wonder what that's so weird. Do you think in English or?
Yeah.
Yeah.
Well, I pretty much grew up here, so I do. But I mean, there's some stuff that I like x-rays, like we had to go through my mom's MRI, her recent MRI and her recent x-ray. And so she didn't really understand, but I feel like they're more at ease when I'm there because, she'll explain it to us on the car ride home. Like that kind of
exactly
thing.
What's going on. Yeah, that must be tough, honestly.
No, not really. Like, they were traveling for 2 months. I didn't know what to do with myself because I had my day off. And I was saying this to other people. A lot of my patients know that on my days off, I do that because I'm always out with my parents. So they're like, so what have you been doing since they've been gone? I'm like, I don't know what to do with myself. I don't know if I should be napping. Should I? So I worked on more research for my blog. So I got a few blog posts down and...
There's always something to do.
There's always something to do. Always.
Do you have anything else you want to talk about?
Let me ask about you.
Yeah, ask about me.
Okay,
sure.
Well, what, I'm just like, I love medicine doctors too. So what made you pick that route?
Yeah, this is a tough question, right? Like I was saying before, chiro or medicine my whole life. I don't know what to do. But I always wanted to be a doctor because I always just wanted to be a surgeon when I was younger. Like that was my dream. I just always was so amazing to me that someone so qualified, they can literally, like just objectively speaking, they can cut somebody open, take something out, and then stitch them back up. They live a good life, right? So that's what always drew me towards that. But as I'm getting older and I know a lot of doctors and people in med school, I'm realizing, man, the 120 to 130 hour work week is not looking too hot for 7-year residency. So, I was kind of just thinking, what do I want to do? And I'm a huge biochemistry nerd. Me and my buddy Drake, we are such nerds that we literally listen to the nerdiest podcast called The Drive by like Peter Attia. So he's this, you haven't heard of it?
No,
I'm just kidding. But he himself went to Johns Hopkins. He was a general oncological surgeon, really prestigious guy. And he's like, I don't want to do this anymore, and became a full-time longevity doctor, basically. So it's seems to be like a newer field kind of emerging. And what he does in his podcast, he mixes like biochemistry, pharmacology, all this type of science and medicine in order to explore different parts of living as long and as healthy as possible. So things like Alzheimer's, cancer, heart disease, right? Like that's the main thing that older people die of. Doing research on centenarians, people that live to their 100, and they were finding out that those people still die of the same things, but it's just offset by like 20 or 30 years. So with his research, with all that, and the field as a whole, guided towards helping people live as long and healthy as possible, and it mixes biochemistry and stuff. So I just, that's what I want to do. So I'm thinking maybe try to get into internal medicine, become an internist, and then just like open up my own practice maybe, because that's what he does. He just has like a select few of patients, and then he just tries different drugs on them pretty much and helps them live long. And the reason why this is so fascinating to me is because it focuses not only on one thing. It focuses on, kind of like chiropractic. It's like the whole body. And so you're not only worrying about Alzheimer's, you're worrying about cancer, you're worrying about heart disease. And everybody's completely different. It has different genetic makeup. So it's up to you to figure out what's the best for that specific patient. So right now, that's where I'm at. And the reason why I want to do this too is because there are like a lot of drugs on the market right now. Like there's metformin, there's rapamycin, there's resveratrol. There's all these different drug trials. There's human drug trials going on right now. Various different people of different ages and different populations. And they're just going to see within the next couple of years to see if like supplementing these drugs will improve the health span and their longevity. So that's currently in the process, and I'm just fascinated with that because in the future, there's not a lot of people in Canada doing that. I don't know if many people are. There's just like people in the States right now, but just the future of thinking about, wow, this podcast, one day if I'm a longevity doctor or whatever, I can like spread the message through the podcast. If it's like, oh yeah, make sure you take 2 grams of this supplement every day or something such as that. And yeah, so just lately I've been obsessed with longevity because it mixes my passion for the biochem of the body and living longer so I could help my family and friends live as long as possible. So
yeah, I really love wellness care. Like for us, like that's what I would call wellness care.
Okay.
And I absolutely love it. I love when I hear this. I don't know if you've heard about this. There's certain health centers that are opening up. So they've got all these disciplines in there. And I love that there's so many of them working together to like actually have really great results.
Collaboration.
Yeah.
That's what it's all about.
And I always, and you know, and sometimes people say, well, I don't know if I should go to a physio or if I should go to chiro or if I should do massage. And I'm like, you know what? It's better to have an actual team instead of just one person, because sometimes one person isn't enough.
It's true.
And like with massage, I always recommend massage, especially if someone's so tight and I know Grasson's not going to help right away, and I'm like, you need to go get a massage first.
You need to get it worked.
Yeah, you really need to go get a massage. And you know, for physiotherapy, I know there's so many ways people can really benefit from physiotherapy. So I love where I see the future going, and I've seen it actually in BC as well as in Ontario, and I think there's one clinic that might be opening up in Alberta. There might already be one there, but I'm excited for it to come to Winnipeg.
Yeah,
I think we're kind of a little behind.
A little bit,
yeah. Just a little bit, not too far, but you know, like just having a wellness center with everything in it would be so great.
Oh yeah, that would be so cool. And you know, there's things that the massage therapist that would see that maybe the chiro wouldn't, or the chiro would see that the doctor wouldn't. And you know, it's just all about teamwork and really focusing on the patient and what they need.
Right.
So,
and even like with naturopaths, like there's so many things that they can do that, you know, we wouldn't know too much about.
It's true.
And you know, there's so many things.
That's cool. So you just combine all of it in order to give the best quality care you can. That's what it's about at the end of the day.
Yeah, exactly. So. I totally agree.
All right. Any other questions for me or no?
No, I think that was it.
That's
no,
it, eh?
Well, actually, no. I have another good one. I don't know if your listeners would want to know this. Why did you decide to make this podcast?
With you?
Well, no, just in general.
Oh, with just in general?
Yeah.
Because I just always wanted to have some type of content online, I guess, and I just had the year off, and I'm always keep myself super busy, so I was just dying not in school, and I was just working, serving lots. I'm like, you know what, I'm just gonna start a podcast. I don't care. And I just kind of went in with no real solid plan. I was just gonna figure it out as I go. It's called Black Coffee with Ice because I fast. Most days I fast. Okay. The reason why I do that is just because I know it's not for everybody though. It's just a disclaimer. You know, some people have struggled with like eating disorders and things along those lines. It's not for everybody, but just the reason why I practice it is because when you're in your fasting time, when you're only having water, tea, black coffee with ice, or other things, you know, your body's not producing any insulin, so you don't get inflamed. You know, each time you have sugar, your body produces insulin, inflames the body. So if you're eating like 6 times a day, you're having those 6 mini insulin spikes. That's why people are like tired after breakfast. But the reason why I'm doing this and I feel a lot better is just because it decreases the amount of inflammation, and if you decrease the amount of inflammation, it seems to have a positive effect on longevity. So yeah, it
does. Yeah, it's true. Like when like I'll have, you know, it's funny you say that because I'll have people come in and they are super inflamed, and if everything is inflamed, they're putting more heat on that. I'm like, well, you're just making it more inflamed. You need to switch it to ice. Like with swelling, right? So I'm like, you know, you really need to put ice on that. They're like, well, I like heat better. I'm like, doesn't matter what you like better. It's what your body wants you to do right now. And so yeah, I'm glad that you said that. The inflammation is a huge thing, and I think it's happened a lot more in the past few years, and it probably has something to do with our food that we're eating, I'm sure.
100%. Like people say that preservatives aren't bad, and you know, GMO is fine and all this stuff, but you know, why is there such a higher rate of cancer these days compared to,
or even allergies?
Yeah, allergies. Yeah.
I know there's a lot of stuff. Like I remember when I was growing up, maybe 1 or 2 students in like our school had peanut allergies.
And now
there's so many
yeah
so many different allergies. So yeah, and my friends that are nutritionists always talk about inflammation, like that's like their big thing, and gut health is something
that would be so cool
about all the time.
Maybe in the future, you and because I have multiple mics, right? So maybe we could have, you know, a little nutritionist, chiropractor talking some health topics or something. That'd be cool.
Yeah, we'd be here for like 5 hours.
That's cool though. I just got to get cameras that last that long.
Yeah.
It'll be fine.
Yeah, no, gut health is a huge thing. And yeah, like I say, it's everything that you're putting in your body. It all comes out somehow. So
yeah. You are what you eat.
yeah, that's true.
Before we finish here, just explain like what chiropractors do.
What do chiropractors do? Okay, so we deal with mostly musculoskeletal stuff. So musculo is muscle, skeletal are your bones, and so together, you have your low back pain, anything that causes mechanical pain. And so we work on all of that, especially with what you'll notice is if a joint is not moving as well as it should, you'll have like reduced range of motion, and you'll know that when you have that weird neck pain or that weird back pain, you're like, oh, I can't turn this way. That's usually a combination of your muscles and your bones. And so we work on that. We also focus on the nerves as well.